Hello, my name is Chris Baker. I'm also an ambassador for New Jersey, and I'm honored to introduce you all to Rebecca Alexander, whose topic is addressing mental health and in the needs of the Usher community, step 1 and beyond. I was diagnosed with Usher syndrome this last year. Rebecca is one of the first people that I met in the community. I have good days and I have bad days, but with the help of my wife, parents, family, and especially Rebecca, I am just taking it one day at a time. She is an inspiration to all of us. Rebecca is an award-winning author, psychotherapist, disability rights advocate, and extreme athlete and fitness coach. Rebecca is almost completely blind and deaf. She is grateful for every sound, sight, and sense. Rebecca transforms personal adversities into a platform for empowerment and advocacy while she educates and inspires others. Rebecca is dismantling societal and personal barriers. Thank you.
Okay. You can all hear me? I am so bad at standing at a podium. I want to just move around, but I can't do this, so I'm going to have to do my best. Okay. Welcome, everyone. I know that we're running a little behind, so I want to be concise. Okay. So I'm Rebecca Alexander, and I am a white woman wearing a black jumpsuit that I got on sale at Nordstrom Rack. I have dark brown hair, and I hopefully don't look my age of 45. So I want to address the mental health issues. You guys are hearing me okay, right? My implants are giving me, I think, accurate information, but I'm not entirely sure. Great. Thank you. Okay, so I am a psychotherapist first and foremost, and one of the things that I have found as not only a psychotherapist, but as a woman who's living with Usher syndrome and deafblindness, is that throughout the years, and I've now been in practice for just about 20 years, that there is a major disconnect between the mental health care that is provided in this country and the needs of people who are dealing with deafblindness, who are progressively losing their vision and hearing, and that repeatedly what I see is people reach out to me and they say, hey, I'm looking for a therapist, and I'm really hoping that you can help me find someone who is well-versed in either low vision or in deafness or in being hard of hearing, someone who knows sign. There's obviously a large spectrum for those of us who are living with Usher syndrome. And the number one complaint is that people go into a therapist's office or they meet with a mental health provider and they spend the majority of the time educating the mental health provider about what Usher syndrome is. And so somehow then they're paying a mental health provider to teach them about what it means to be progressively losing 2 of your vital senses. And it just ends up not working, and so needs aren't being met. So one of the things that I did is that I partnered with the Coalition and Global Genes. We applied for a grant, and the grant gave us money to be able to create a curriculum, which I created, that was actually to serve the ambassadors for the Usher Syndrome Coalition. And we had a 10-week program that I devised because ambassadors are the ones who are out, I call them the frontline workers. They're the ones who are out in the world. And unfortunately, and in particular, they're on social media. We all know that social media can be absolutely wonderful, but when it comes to mental health, I think it can be also one of the most damaging things that people can be exposed to because of how much information is out there and misinformation. And oftentimes, people who are really, really struggling will put the hardest stuff out there and not have the best resources. And so I wanted us to be able to have something that was more tangible so that we could address that. So because the ambassadors are the frontline workers, I wanted them to be able to be given not only the tools to be able to deal with their own grief and loss, to be able to deal with their own anxiety, to develop distress tolerance, to have a better understanding of what it means to have boundaries, how to deal with misinformation and disinformation on social media, because oftentimes on Facebook, you may have someone who's providing, medical advice, who is not a medical doctor, but saying, hey, I'm taking such and such drug or such and such vitamins, and I highly recommend it, and then people jump on that. And so we know that we have to be a bit more careful about how information is spread and shared. And so with this program that lasted 10 weeks, I wanted to equip them with tools so that when they go out into their own communities, whether it's online or whether it's in person, that they would be able to share some of the resources to help people living with Usher syndrome better address all of the different types of emotions that come with having Usher syndrome. So I've been doing this Usher syndrome song and dance for quite a long time, since I was 12. I was diagnosed with RP. And the one thing that I knew is that each year I would come back for these conferences, and I would be so, at first it was nerve-wracking, and it was sort of like, oh, this is weird, and look at all these people with canes, and then look at all these people signing, and then over time, I became sort of one of those people. And not only did I become one of those people, I was like, this is where my confidence and my sense of self and my identity really started to blossom and develop. And that was in not seeing myself as someone who had to feel a sense of helplessness and hopelessness, that if we don't find treatment, if we don't find a cure, if it doesn't happen right now, that my life is going to be doomed. And I think that part of what's so wonderful about this conference is that we have all of the information, as much information as we can, for as many people as we can. And that is that we have the medical information to know what is happening in terms of research, and we also have some of the accessibility information. And now we have mental health information that we're continuing to build and develop for our community. So this 10-week curriculum, we are now hoping to then further build it out. I've partnered with another person who actually has retinitis pigmentosa. His name is Charlie Kramer, and he is a disability coach. And we are now trying to bring this out to kind of the greater community and population to be able to work both virtually, and then we're working on trying to be able to create retreats so that we'll be able to potentially twice a year be able to go and really address the mental health needs of our community, so that you have professionals who are living with this condition also addressing you as someone or a family member of yours living with Usher syndrome. So the mental health needs continue to grow, as we all know. I think COVID really put mental health on the map. And I think that we have a lot of really exciting stuff that is continuing to develop, and that the coalition will be sure to make sure that that information is disseminated and shared with all of you, so that you have the resources to be able to support not only yourself, but your family members. Yeah. I'm trying to be mindful of time. I don't think we're opening this up for questions. Yes. Okay.